Delirium is actually a really serious problem. It can lead to longer hospital stays, increased rates of injuries through falls, and it can also result in increased sickness and even death. So it is a really serious problem with some fairly serious outcomes. My name's Will Browne and I'm a geriatrician here at Eastern Health Maroondah. It consists of an acute change in thinking, memory, concentration and attention. One of the key features of delirium is that it fluctuates, sometimes quite dramatically over the course of a day and between days. So it's not that uncommon for a doctor who's on a night shift to come by and see a patient who's very, very agitated and distressed and confused, and to write about how delirious they are in the notes. And then I come into my ward round in the morning and the patient's sitting up in bed and, "Hello, Dr. Browne, how are you?" And the reason is that there's a big fluctuation over time. So that's a characteristic feature of delirium and helps to differentiate it from a dementia, which tends to be more static or consistent over time. For most people, they can return to close to their previous level of function. There are some people who emerge from a prolonged delirium with deficits, and so it's incredibly important as a doctor who cares for many patients with delirium that partnership between healthcare worker and family, loved ones and the patient is vital to identifying delirium early, and so that we can begin the strategies which we know will make a difference as quickly as possible.